let's just talk about COVID. And what I would normally say to everybody is when COVID hit, it is a physical health pandemic, but it is not just a physical health pandemic. Actually, this pandemic has three things. One, of course, it's a physical pandemic. The second, it is a mental health pandemic, and third, it is a misinformation pandemic. What has happened over the periods is that initially when COVID came, everybody was quite happy, just sitting at home, and the expectation was that maybe in a month's time or 6 weeks' time, when we are locked in, COVID will disappear, but it has not. So what has happened afterwards is that the uncertainty, now nobody loves uncertainty, everybody hates uncertainty. And with COVID, the uncertainty in our life has increased many folds. So whether it is about our own health or family's health or work or job or business or children's future. So the uncertainty in life has increased so much that more and more people are coming down with whether it's depressive symptoms or anxiety. Now, this anxiety is what we would normally call as health anxiety. Now, most of the people will call it a COVID anxiety. Health anxiety, again, is not something new. If we used to see 10% people with a diagnosis of health anxiety, which meant people worrying that they might have a cancer or they might have a heart disease or they might have a heart attack. Now, the number of proportion of people we see with COVID-related health anxiety is at least 60 to 70%. So most of the work that we are doing is directly or indirectly affected by COVID. Now, the health anxiety is there because of uncertainty and what will happen. But there are a lot of people coming up after they've had COVID themselves. They've been locked down into a single room, isolated, or they've lost family members due to COVID. So a lot of bereavement and grief reactions that we are seeing. And of course, a lot of depressive symptoms because of lack of relaxation or happiness or going out and doing things. So we are seeing a lot of COVID anxiety, bereavement and grief reactions, and depressive symptoms. The vaccines add something different to this whole anxiety spectrum that we are seeing. Now, vaccine hesitancy has not been new. I belong to a generation where pulse polio was started, pulse polio immunization program was started, and I, as a medical student, we were asked to go to villages and to give the drops, and we saw vaccine hesitancy there also. The difference being at that time, what we were seeing was that we could justify it by saying, so these are people who are undereducated, less educated, so they don't know. Now what you're seeing is not just the uneducated or lesser educated people, but this is we are seeing in people who are educated, well educated, and it is just the misinformation. I mean, from where you're getting, what you're getting, and in life, everything that we do it on a risk benefit analysis. And for most of us, we are able to ignore the risks associated. We can't, obviously, none of us can say that there's no risk. I mean, you take a flight, you step outside your house, it's no risk, but you accept it. It's an acceptable risk that we all still get on with our life. But this vaccine hesitancy is very, very difficult to explain and understand considering what people have seen happen in our country in April and May. So very, very surprised with what we are seeing. But as previous speaker was saying, it is not just a phenomena being seen in India. It is also being seen in elsewhere. I mean, I'm in UK, as you said, and if you open the television here, so there are a lot of doing positive advertisements, and they're running a big campaign about getting people in and getting the misinformation away and getting people to go and get their vaccines. So it's not just a problem that is with India, but it's worldwide, and it's very, very difficult to comprehend.